Hey everyone, good evening. Welcome to Monday Night Spark. I hope everyone is off to a great start to the week. In this video, tonight's topic we're going to be talking about live is 3 reasons why you should be foam rolling your hip flexors. So just to give you some context for tonight's talk, I have linked in Facebook, I have linked the blog post of the live that we actually did 3 weeks ago. And in that live, we really got into the topic, and this was something that I polled the audience, and you guys wanted to hear about, specifically soft tissue care for runners. And we got into what are the different types of soft tissue care that runners should go through, and I have linked that blog post, including the video to the live there. So if you are watching this later on, so you're watching this on the replay, you'll be able to click on that link and see a little bit more in-depth topic on that topic. So I see a couple of people are jumping on here. So as you jump on here, guys, if you are on the live, just comment live. It will help more people be able to see that we're talking about this topic right now, and we'll be able to help more people. So I highly appreciate if you can do that. If you know a runner, if you know a dancer, if you know a gymnast who should be hearing about tonight's topic, I would like you to tag them in the comment box. If you tag them in the comment box, then they will know that we're going live right now and we're talking about this topic, because I'm really passionate about this, because all 3 of those populations, so all 3 of those people that I commonly help, runners, dancers, gymnasts, tend to have decreased muscle length of the hip flexors, or complain of tight hip flexors, or complain of tight hips. So if you know of anyone who has ever complained of tight hips, or have had low back pain, or have had hip pain, then please tag them in this video so we can get them on and they can be able to see this. Like I said, my goal is to be able to kind of reach out to you guys, help more of you out there. All right, so we are coming off of the Cheshire Half Marathon now. 2 weeks out. For my runner friends out there, hopefully you have your sights on a new race. I did sign up for the Fairfield Half myself, so hopefully I will see some of you guys there. I know we were actually commenting and talking last week to a bunch of you runner guys, and we said we were going to go maybe do a little kind of dynamic stretch together and connect, do a little warm-up before the Fairfield Half. So if you are running the Fairfield Half, comment that you're running, and we will try to get together and do a little kind of warm-up together, as well as a little dynamic warm-up movement prep before the half marathon. This kind of is going to already take me off on a little tangent, but remember, do not static stretch before your run. You want to do a dynamic warm-up prior to your run. I was just actually thinking about this today and was talking to one of my friends about this, because at the Cheshire Half, if you noticed, at the Spark Physical Therapy booth, we were not offering static stretching, one-on-one stretching, like some of the other PT clinics that were there, because our belief and our motto is that we're not going to statically stretch a muscle that is cold. So that is not the best thing to do for a performance standpoint, as well as an injury reduction standpoint. So you did not see any static stretching going on prior to the race. If you did want to get your stretch on, then that best time for that would have been after the race, all right, not before the race. So a bunch of you guys are jumping on here. Stephanie, thanks for jumping on. Ralph, Taryn, congrats to you. Taryn's smashing some new running goals that she has set, some goals and some sights set. Carly, thanks for coming on. Kevin's on. Libby's on, and she's live. Thanks for commenting, Libby. Erin, good to see you. Erin, going way back. Good to see you. Stephanie is on, and Taryn's live, and Sarah's joined. So yeah, Libby says that's her. She's got some tight hips. And so Stephanie unfortunately didn't finish the Cheshire Half, that she got lost. Oh my goodness, that is terrible. That is very terrible. I hate that in a race, when I think Cheshire, for the most part, every time I've done the half course, has been fairly well marked. But yeah, that's a terrible feeling when you are running a race and you're not sure where to turn. You don't have someone there pointing you in the direction. So Stephanie, I am sorry that happened to you. That is not a great feeling. So you probably wound up running more than 13.1 that day for sure. So let's get into tonight's topic. If you have tight hips, why you should be rolling your hip flexors. So I'm going to tell you right now, actually, I will share with you a specific video. So a little kind of training how-to video on how to foam roll your hip flexors, how I like to do it. So if you do want a video of that, I will message you directly. So just type in the comment box video, and I will send you that video on how to properly roll your hip flexors. But so we're going to get into some foam rolling. So this was one of the topics we talked about on proper soft tissue care a couple of weeks back, foam rolling. So the benefits of foam rolling are, number one, you can do it yourself. So you're not relying on someone else. So you're not relying on someone else to actually do it for you, and you're able to actually take care of yourself, right? So it's always good to do treatments that are going to benefit you as opposed to relying on other people for passive treatments, right? So that's one of the other big philosophies at Spark Physical Therapy, is that we want to put you in charge of your own health and provide you the tools to take care of yourself. So going to a physical therapist, massage therapist, chiropractor 2 to 3 times a week for 6 to 8 weeks to cure your problem is not a great solution. So providing you the tools, that's the best thing that we can do, is empower you, provide you the education. That's why I'm actually on here now, and I've dedicated, blocked this time specifically for you, that I'm not seeing clients, because I want to be able to reach more people, educate more people on some simple strategies they can do to take care of their bodies. So what does foam rolling do? The benefits of foam rolling is, number one, it warms up your muscles. So it has been shown, there is very little evidence and research on this, by the way, on foam rolling. So a lot of it is anecdotal, but there is some small studies that have been done, low end numbers, so just a couple of patients or a couple of subjects within those studies. But it has shown that it does increase your muscle temperature, so it helps warm up your muscles, warm up your soft tissue. I would argue that other activities can also do that. So you hopping on a bike, you going for a light jog will warm up your muscles. You're going to increase your core body temperature. But foam rolling can do that as well. It can help you recover after a workout. Again, some small studies have shown that does enhance recovery. So some of the theory is maybe it increases blood flow. Increased blood flow will help you feel less sore, so you'll have a better recovery and you'll be able to work out a little bit harder next time. In general, what I know I feel, and most of my clients report, is that you feel less tight. So if you feel less tight, in general, you're going to be able to have a little better workout. So now the question and the debate is, do you feel less tight because you're actually stretching muscles, or are you breaking up scar tissue, connective tissue, right? So those are some of the theories that have been out there. To make a long story short, I would say no, you're not doing both of those things, but you are affecting somewhat of your myofascial system. So it can be thought of as a myofascial release. So the fascia covers your muscles, so it's like saran wrap over your muscles, and that's fascia, that's connective tissue. And you can release some of that connective tissue, which may give you the perception that your muscles feel looser. So that could be why you are feeling looser, is you're releasing some of that fascia. You can also feel looser because your tissue temperature increased. Like we said, you were warming up your muscles. But probably the most common reason that we feel looser is that we've actually stimulated our nervous system. So we're really looking at neurologic changes that occur with foam rolling. So there are little nerve receptors in our muscles, and what we're doing is when we're rolling over it and it hurts so good or feels so good, is that we're stimulating. So it gives us that perceived release effect versus a true structural change effect. So we're not really structurally changing the muscle length when you're rolling over it, and your hip flexor feels a lot looser after you roll your hip flexors. So that's just getting into a little bit of foam rolling and what it does. In the healthcare world, there is a lot of debate because there is not a lot of literature on it. There's a lot of people who say, well, don't do it. There's a lot of people who say, do it. I'm more in the camp of if it feels good, then do it for a small amount of time. That should not be your workout. You should not say, I'm going to work out, I'm going to the gym, I'm going to foam roll for an hour, right? So spend 30 to 60 seconds per muscle. If it makes you feel better, if you feel looser after it, like I know it does me, then that is your little warm up prior to your workout. So you're increasing some of your tissue temperature, you're feeling looser, so you perceive that you feel looser, so maybe you're going to move better now. So remember, the exercise is actually the movement. So whether it's you're working out and you're moving, you're doing squats, you're doing lunges, you're doing deadlifts, whatever you're doing, or you're going for a run. So you're going for a run, or my gymnasts, before their conditioning, I recommend they're rolling, right? So they're doing some foam rolling before they go through their conditioning and their warm-ups, right? Same thing for dancers. You're going to do your foam rolling before you actually get into some of your technique at the bar, before you do some of your different dance-specific movements. So that will serve to kind of prime the body, warm it up, you feel a little looser, now you're moving a little better, and you're also a little warmed up. So that is really what foam rolling is doing for us. So I do want to acknowledge that we got some new people jumping on here. So Stephanie is registered for the Yukon Half in June. Nice. I have not heard of the Yukon Half yet. In June, I do not, well, I do have the Fairfield in the first weekend of June, but if it's later in June, I may even consider that one. I haven't heard of that one, so that's great. So Libby is running her 27th marathon in June. Wow, that is super impressive. 27 marathons. I've run one marathon so far, so thinking about training for 27 of them is a little daunting. Jen's on here. Jen, good to see you. Heidi's on here and Kelly's on here. So we got some dance moms on here. Peter's on here. I know Peter's a runner. So this is great. We got a nice little combination of people. So guys, if you are here on the live, just comment live. It will just help this reach more people. So again, I'm not doing it for ego purposes whatsoever. It is more of you hit that like button, you hit that love button, you add a comment, and then Facebook, what it does in its algorithm, it's going to put this video on people's news feeds who are jumping on now. Because everyone knows, right, this is the time that they're going on their social media, they're scrolling their news feeds. Maybe this video might pop up, and then I can be able to help more people. So by you commenting live, that will definitely help a lot. If you are on here on the replay, so you're watching this on Team Replay, just type in their Team Replay, hashtag Team Replay. Just, again, that's going to be able to help this video reach more people. So I greatly, greatly appreciate it. So we're talking about tightness in the hips. Guys, if you have a question at all, please type it in the comment box. I'm happy to answer it while we are here on the live. So the second thing I wanted to talk about today that I thought was kind of a common question that I do get is what causes tightness of the hip flexors? So just to give you a little anatomy lesson here, the hip flexors are made up of two muscles. So your iliopsoas and your iliacus. So those are your hip flexors. Those muscles actually start, the iliopsoas starts in your lumbar spine. So the lower lumbar vertebrae, your lowest bones in your lower back area, that's where the iliopsoas connects, and then it connects down to your leg bone, your femur. The other muscle, the iliacus, starts in your pelvis area and connects down as well. And those muscles function to bring your knee up toward your chest. So if you think about if you're running, you're lifting your knee up, that's the motion that your hip flexors do. For you dancers, if you're doing kicks, you're doing kick line, right? Everyone knows like the Rockettes. Rockettes are constantly using their hip flexors over and over again as they're kicking, all right? So gymnasts, think about your beam routine, right? Think about a lot of your extensions, your leg movements, but more commonly, what I tend to see is if you have an arched posture, so you're really bringing your spine forward, you have that increased arch or lordosis, we call it, then that can cause some adaptive shortening of your hip flexors, as well as those of us who do have a sit-down job. So if you're at a desk most of the day, or if you're in a car most of the day, I have a lot of clients who are traveling a lot in the car, or they have a long commute, then you're constantly putting those hip flexors in a shortened state. So if they're constantly in a shortened state, over time, the muscle length is going to decrease. So then they're going to get tight, they're going to have decreased muscle length, and then you might perceive some tightness as well. And then it might be hard for you to feel like you're loosening them before you go on a run or before you do an activity. So those are the things that can kind of cause that tightness in the hip flexor muscles, is that prolonged sitting or repetitive kind of kicking motions, or repetitive running. So running, distance running, and repetitive sport, you're constantly bringing that knee up, constantly bringing both legs up as you are running. So that can cause those muscles to go in a shortened state if you're doing that over and over again, and you're not doing proper soft tissue care, like we're talking about today, is foam rolling those hip flexors. So guys, if this is helpful, just type in helpful. It just, again, will let me know if we're kind of right on track here. Erin, thanks for commenting that you're here on the live. Janet, good to see you again. Janet, thanks for tagging. I really appreciate you jumping on here on the live. I know you've been a big supporter, so thank you very much. Stephanie says that the Yukon race is a new name for the Iron Horse half. Yes. Okay. I've heard of the Iron Horse one. I've heard that is actually a very good race. So thank you for educating all of us on the road races here local to us in Connecticut. Vanessa is on IG. Thank you very much. I'm glad this is helpful for you. I am looking forward to actually meeting you and getting you going on a good program. So we do have a question here. So does foam rolling help tendonitis or prevent tendonitis? So great question. I'm going to only speak, let's stick tonight's topic on just hip flexors, because I had so many things I wanted to go. I do want to keep this video within a certain watchable time frame. So talking about hip flexors specifically, hip flexor tendonitis is a little different from some other tendinitises. So for some other muscles or other tendinitises, I would say rolling the muscle belly, yes, will help. Hip flexor tendonitis is, number one, not that common. Most people who have hip flexor tendonitis probably don't. They may have some anterior hip pain, so pain in the front of the hip where the hip flexor is located, and it may be caused maybe due to an impingement in the hip or more of a hip instability. And then what I find is the muscles themselves get tight or spasmed, or they have trigger points. And then I will commonly do something like dry needling to help that hip flexor muscle, or the foam rolling that we're talking about right now. Those will be good techniques. So hip flexor tendonitis, even though I have seen it, it's more common in someone who's post-surgical. So if you had a hip surgery, you had a hip scope like I did, had a labral repair 8 years ago. I told that story a couple weeks ago. You can get a tendonitis of the hip flexors, but it's not a common diagnosis to have, more due to repetitive overuse activity like most tendinitises. Other muscles, I would say yes. So Achilles, posterior tib, shin splints, that kind of thing, then foam rolling can be beneficial, not for the tendon, but for the muscle that connects to the tendon. So that's my take on foam rolling. If you do have a tendonitis, then you want to foam roll the muscle belly itself, not the actual tendon. All right, so let's get to our last topic of the evening. So that is, how can foam rolling your hip flexors decrease your pain? So why would I prescribe basically someone to foam roll their hip flexors that I'm coming to see? So I'm thinking about the most common causes of why I would prescribe the helpful video that I'm going to post for you guys. If you do want the video link, again, comment video, why I give this video to my clients. Most common reason, first off, is going to be low back pain. So low back pain, especially for that patient who has what we call extension-based low back pain. So their back pain worsens with bending backwards. So that we're thinking most commonly found in my gymnast population. We know the whole spondy patients and stress fractures, very common in gymnastics. Someone who's leading down that path and they have pain with extension activities. So they do back bends, back walkovers, back handsprings, all that stuff going backwards. that causes extension in your spine, and most of those patients will have tightness in the hip flexors. So if the hip flexors are tight and they're limiting mobility, then they actually can't reach back as far to go into a bridge or to go into a back walkover. So my goal is to improve the length of the hip flexors, or do some soft tissue care, or perceived, whatever we're kind of talking about is perceived flexibility, before they go into those skills. So gymnasts are very common population. I'm prescribing that for a lot of those gymnasts. Same thing with dancers to a certain extent, not as much in the gymnast, but in both of those populations, guys, if you're looking to improve your splits, especially on the back leg. So for instance, it's more common, you're gonna be limited in your left split, let's say. So it's your right hip flexor, that's your back leg. That is going to be a little bit tighter. So I would commonly have them roll out the hip flexor on the right side and then the hamstring on the left side of their tight split. So to kind of specifically look at that. So low back pain is number one, especially extension-based back pain, but also my middle-aged folks, my active adults who are getting back pain and they have a sit-down job. So they're sitting all day and their hip flexors are short. I take them through what we call a Thomas test position. I see that their hip flexors are short. Then I'm going to want them to do some foam rolling for those hip flexor muscles prior to maybe doing some glute neuromuscular re-education, some glute strengthening exercises before we actually stretch the hip flexors. So I would want them to foam roll the hip flexors. So low back pain is number one. Number two is going to be hip pain patients. So those that have hip pain, most commonly, as we kind of already alluded to, someone who has a femoral acetabular impingement, or FAI, impingement in the hip. You could have that due to impinging of bone. You could have that due to a labral tear. So those can cause, a lot of times when you're in pain in the front of the hip, trust me, I've been there, because you're walking differently, because you're having pain, then the soft tissue will actually get tight, and it will get irritated, and it will get trigger points in it. So you'll actually have some of that pain to the soft tissue, but the primary problem is more of an intra-articular problem, so inside your joint. So if it's an impingement inside the joint, if it's a labrum inside your joint, that you have a labral tear, then the soft tissue. So I will prescribe the foam rolling for those patients with hip pain, not to actually treat the underlying problem, but to take care of some of the secondary consequences of them having some of their hip pain. All right, so those are the most common reasons I would prescribe foam rolling, as well as definitely my runners who are tight in the front of their hips. A lot of times, especially if you are leaning forward a lot for your running, you're not doing a lot of stretching into extension, so opening up, and you have kind of a poor posture with running and you're in a little slouched position, then I'm always going to prescribe things that are going to open you up, going to extension in the spine. Scorpion is a great exercise to stretch the pecs, stretch the spine, stretch the abs, stretch the hip flexors, or something like the pretzel stretch. Those are all great stretches to do for my runners, but I would commonly have them foam roll those hip flexors if they are complaining of some of that tightness, and if I have assessed that they actually do have tightness in the front of the hips here. So Maura, good seeing you. Thanks for jumping on. Nice to see you here on the live. Libby says this is helpful. Taryn says, thinking of doing the Father's Day 5-miler in Brantford. Yes, I hear that is a great race. I have personally never run that race because it is Father's Day. And even though I love running and I love doing races, I can't do that to my family and make them go to a race to cheer me on Father's Day. So usually we kind of hang low. We like to make it a pool day or a beach day for Father's Day. But I hear nothing but great things about the 5-miler in Brantford on Father's Day for those looking for a local road race. I would highly recommend that based upon everyone I've talked to that has run the race. Teresa, good to see you. Thanks for jumping on. So Libby has a question. Are the piriformis and hip flexors connected? So very good question here. Let's clarify that right now. Piriformis is located in the back of the hip. So the piriformis connects to the femur bone, so your thigh bone, but it attaches to the back part of your pelvis. So they actually are on like opposite sides, essentially, of the hip. So the piriformis is going to help externally rotate the leg, so it helps turn out. It's also, if you are a runner, it can be commonly tight in some runners I see that are overpronators. So those that have really flat arches and they wind up overpronating, or they're pronating too long during their running, sometimes you can get overuse of that piriformis, or it becomes in spasm, and you can get trigger points in the piriformis because it's kind of working overtime to control some of that control some of the pronation. So we call the piriformis muscle the anti-pronation muscle. So they are two distinctly different muscles, and problems in those muscles will cause different types of symptoms. So they are distinctly different. So I hope that answers your question there, Libby. Thanks again for the great question. So Stephanie says, I feel like I can't keep the foam roller on my hips. It's hard to stay on it. It rolls away from me. So if you're having trouble, I would recommend, so I'm going to post, like I said, if you want the video, I'll show you the video, how I like to do it with the other leg up in front. So it helps stabilize, if that makes sense, and where you can kind of lodge it in the front of your hip. The other thing I could recommend is utilizing a ball, possibly. So for areas that are a little tough, like even the lats sometimes, I will commonly prescribe either a tennis ball or a lacrosse ball, and that might be a better way to help loosen up that muscle. So hopefully that answers your question, Stephanie. Sarah's on. Thank you for joining, Sarah. Kristen's on. Good to see you, Kristen. How are you? Maura says she's a hot mess and needs to come see me. So Maura, yes, let's do it. Let's take care of you. Kim, oh my goodness. This is great. I'm seeing a lot of old names here that I haven't seen in a while. Good to see you, Kim. Kim goes way back. QC days. Sunder says, how many times a week should we do foam rolling of the hip flexors? Should we do it before or after a run? Oh, great question. So how many times a week? It all depends upon how much time you have, right? So like I said before, you should not be foam rolling for 30 minutes or 60 minutes. You want to do your foam rolling in 5 minutes and get out. So you want to think about the most important muscles that you need to foam roll, Sundar. So based upon what you're feeling tight, based upon what you've been assessed that you have tightness. So for example, like I'll see a lot of patients actually who are like going to town on their hamstrings, and they're like foam rolling their hamstrings, and then I assess them and I'm like, your hamstrings actually have normal length. Your hip flexors, on the other hand, really need work. And that's contributing to your back pain that you're having is your hip flexor tightness. So let's stop foam rolling your hamstrings and spend the time and attention at the hip flexors. So I would recommend no more than 5 minutes. So Sundar, honestly, if you are exercising on a daily basis, I would say daily. And you can do it two different ways. You can do it pre or post. I like to do both, honestly. If you're going to do it pre-workout, I would say cut it to 5 minutes only. So some have the belief that if you do more than that, you're really almost like causing an inhibition to your central nervous system, and then you're going to have less muscle power output. And I would only say that would be the case if you were like a power lifter, or you were really looking to lift heavy in the gym and you wanted to, lift your heaviest on your squat or something. I wouldn't foam roll for 20 minutes before you did that. I would get in, get out, 5 minutes tops, just stimulate that nervous system, get your muscles firing. Remember, you're going to stimulate the nervous system, then follow up with some muscle activation exercises, and then go do your exercise or your workout or your run. So that's kind of the protocol there. So hopefully that answers your question. Lisa, nice to see you. Thanks for jumping on the live. Oh my goodness, this is great. It's so nice to see so many people that I know here. Libby, I'm glad that was helpful. Melanie's on. Karen's on. Good to see you, Karen. Rachel is on. So guys, what I want to know from you right now is drop in one thing that you would have learned from today's talk, because I'm really trying to hone in on how I can best help you, the active adult, the runner, the dancer, the gymnast. Let me know what you have learned tonight, what was helpful, what you learned. Drop it in the comment box if you're either here on the live or you are watching this on Team Replay. drop it in the comment box and let me know one thing you have learned. So if you are an active adult or athlete in the Cheshire-Wallingford region who's trying to stay healthy, but pain is stopping you from meeting your goals, here at Spark Physical Therapy, we have a unique treatment approach that focuses on solving these problems with our clients. So we combine hands-on manual therapy work to help decrease your pain, get you moving, and combine that with guided supervised exercises, specific pinpoint exercises, each and every visit with a doctor of physical therapy, not having you do the same exact exercises every single time you go to PT, most commonly given by aides or high school students or college students. So you're working with a physical therapist each and every visit, really to get you to your peak potential. And our goal is to help keep you active while recovering from injury by guiding you in ways to modify your activity rather than eliminating it. That is what I pride myself on. I was actually just talking to someone on the phone just before, and she was telling me how she went to her orthopedic surgeon, and he said that she had pain and she's 49, so she needs to stop running because she's 49. So I do not believe in that philosophy. I do not believe in complete rest in order to heal from injuries. So my philosophy is I'm going to modify your running. I'm going to modify your workouts in the gym. We're going to get you healthy, get rid of your pain, get you moving better, and then gradually build back up to get your body more resilient to be able to stay active, healthy, because we all know the benefits of exercise from a physical standpoint, mental standpoint, and honestly a life standpoint, right? We need to move, we need to exercise, we need to stay healthy. So I really do not like when I hear messages like I heard before by medical providers telling patients and active adults to stop doing what they're doing. So I believe there is a healthy way to be able to do the activities you love, and it's just a matter of finding the correct diagnosis, getting down to the root cause of your problem, and then building up your body and getting it more resilient. So if you're on the Cheshire-Wallingford area and you're looking forward to working with me one-on-one, then probably the best way to reach out to me is you can certainly send me a DM or a personal message on Facebook, or just go to sparkyourtraining.com. You will find all the information on my website there. I have linked the blog post, so that's to the website as well. So you can just go on the website there and you can find out more about some of the services that I provide and help keep you guys happy and healthy. So again, this is Dr. Dwayne Scotti from Spark Physical Therapy, jumping on here live, talking about 3 reasons why you should be foam rolling your hip flexors. In summary, we talked about what does foam rolling do in this video. We got into what actually foam rolling does. We got into some of the misconceptions and what the research and what it actually says that foam rolling does and why it does feel good for most of us and why we feel looser. We also talked about what are the causes of tight hip flexors. So we talked about prolonged sitting. We talked about repetitive motions of the hip. So repetitive movements such as running and a lot of the kicks that dancers are doing. We talked about the Rockettes, right? We even threw in some Rockette music. I feel like we need some music in here. And then we talked about why do I prescribe hip flexor foam rolling for my patients, and how is it going to help you decrease your pain? So we talked about low back pain scenario. We talked about hip pain scenario and how foam rolling the hip flexors can help you. So I hope that was helpful. Again, guys, drop it in the comment box if there was something that you took away from this live that was helpful, because again, it will help me create content for you that is helpful, and I can kind of see where I need to tailor my message and be able to help more people like you stay happy and healthy. So I thank you all. I loved everyone jumping on the live here, so many names that I was familiar with. Thank you guys from the bottom of my heart. I hope everyone has a great rest of the week, and share this out with any friends that you think would benefit, as well as hit that like and love button. I greatly appreciate it. Have a great rest of your night. Bye, guys.